So our next speaker is going to be Steve Eby. Steve is a fixture in Nashville's music scene as one of the town's most prolific drummers, but he's here today to share a very different side to his story. Thank you for being with us here today, Steve, and Steve's going to talk about how surprise billing has impacted him personally.
All right, well, hi everybody. I was asked to tell my adventures with medical bills today, and I'd like to let you know I'm a self-employed musician and a music instructor. Before the pandemic, I played with several bands in Nashville. I worked on recording sessions, and I taught drum lessons at Forks Drum Closet. Now I'm teaching lessons online. You can see my Zoom setup here, and I'm doing a few remote recording sessions from my basement studio. I live in East Nashville with my wife, Tamara, and my son, Sam. Tam is a genetic genealogist, and I was adopted. Back in 2014, she found my birth mother. I gained a whole bunch of new family members all in one day, and we learned that my birth mother had had a heart attack in 2013. She survived, she was fine. And then my younger half brother, 10 years younger almost, had a heart attack in 2014. And this got me thinking, maybe it would be a good time to go get my heart checked out. So my primary care doctor sends me to a cardiologist. The cardiologist orders an echocardiogram. The echocardiogram showed that I had a birth defect in my aortic valve, and they call it bicuspid aortic valve. That means I had two flaps instead of the usual three. The valve was working properly, evidently, so they said I should just have regular echocardiograms to keep an eye on it. So that's what we set forth to do. I had insurance through Blue Cross Blue Shield, through healthcare.gov at that time, and medical bills had really never been a problem for me up to this time. So you fast forward now to 2016, and I go for my third echocardiogram. I went to the same room in my same cardiologist's office where my previous two tests had been conducted, and that's where the trouble starts, all right? So forgive me, I'm looking at my notes here so I can get this done in 10 minutes, but when the bill came, I owed $2,131.20. Yeah. The previous ones had cost me about $300 each for my portion of the echocardiogram, I think. The cardiologist was in network. It was inside a large medical center, which was in network, yet suddenly for this third one, echocardiogram is out of network. I didn't even have to leave the office and go down the hall. It was in the same office. All right, so I decided I was not going to give up without a fight. I made dozens of calls to the cardiologist's office and to the hospital. I have stacks of papers and notes from this one date of service with dates and names, and it took about 5 or 6 months. I finally got the right person on the phone, and they gave me the in-network rate, which by then was a little over $700, but I was super grateful to get that. I feel like I got lucky and I learned a lesson. Now, every time I have any procedure or go to any doctor's visit, I always ask them to confirm that it's in network or I'm headed to the parking lot. It's a thing that can cripple self-employed people like myself, because even if you've done everything in your power and had savings and an emergency fund, 2 or 3 of these things at once can put you down. So my wife, Tam, got a new job with great benefits in 2017. And I showed up to the next echocardiogram feeling pretty confident about my health insurance. They assured me it was all in network. A few weeks later, I get the bill. Now it's $2,300. My head spun around a few times, but I got on the phone, and that time it was just some billing error, and I ended up paying $299 without much of a fight, right? So then we get to September of 2019. I had my 5th echocardiogram. This time there were no billing issues at all. Now there was an aortic valve issue. So I had open heart surgery on October 4th of 2019, and we definitely met our deductible and our out-of-pocket maximum that year, believe me. There were a couple of little things that popped up as out of network, and I think fortunately it was just smaller items that weren't really worth fighting about. But there was such an incredible long list of things attached to this heart surgery and the follow-up care. Yeah, it could have gone off the rails again, obviously. So my recovery went really well. I was back teaching drum lessons 30 days after my surgery. I began my cardiac rehab, and all of my follow-up appointments went great. At the end of 2019, we got a letter from the HR department at TAM's job, and it said that their healthcare benefits were going to change a little bit for 2020. I really wish I had read the fine print. I really wish I had. As it turned out, many of the things that were covered at 100% in 2019 were only going to be covered at 50% in 2020. And I'm talking about the in-network stuff. So I continue my cardiac rehab for the next several weeks because it's all paid for, right? And all these other little things that I'm having, follow-up appointments and some stuff. And next thing I know, by February, we had a new stack of medical bills now totaling close to $4,000 on top of everything that was done in 2019. On March 3rd, Nashville gets hit by the tornado. Our house was okay. Many of our friends and neighbors lost everything. That was just a crippling blow for many of us. The year 2020 just continued to get worse from there. And it's complicated, and I won't bore you with all the details, but there were more medical events with my family, a couple of ER visits, and we got hit with another wave of medical bills. By mid-March, I had a stack of medical bills that totaled about $9,000. And I'm really starting to wonder how we're going to handle this. And that's with insurance, mind you. Then we realized the pandemic had come to Nashville, Tennessee. All of my live performances and recording sessions were canceled for the entire year. I was fortunately able to adapt quickly to teaching drum lessons online out of my basement studio, but that only really generates about a third of my usual income. Tam was able to work her job from home. We converted the guest bedroom into her office, and we dipped into savings for some of those medical bills, and the rest of them are on a payment plan, which we're still paying on. And that's going to continue monthly for, I don't know, another year and a half at least, something like that. Tam lost her job at the end of June due to the layoffs that everybody's seeing from the pandemic. Our health insurance went with it. We could not afford COBRA, which would have been over $2,000 per month for our family of 3. So we went without health insurance during the month of July. And we finally got coverage through healthcare.gov, got a pretty good little plan with Cigna. And this is how I met Tony Garr. He gave us advice and assistance with the application. And I'd like to thank Tony Garr and the Tennessee Healthcare Campaign for inviting me here today to tell my story. And I'd like to thank Tony personally for helping us out when we were really kind of in a bad spot. My family's going to be fine, I think. I'm very concerned about our healthcare system in this country. Many of my musician friends don't have any insurance at all. And I know all of us would like to avoid these kind of surprise bills that can just really hit you hard when you're already down. If we did not have our current coverage and the subsidy through the ACA, we would probably be in big trouble right now. I can only hope we're going to see positive changes in 2021. Thanks for listening. That's all I've got.
Yeah, thank you, Steve, so much for being here. I just, hearing your story, I'm just shaking my head at all of the different hurdles and barriers that you had to face, and really appreciate you sharing that with us. I think that really highlights several different issues with our healthcare system and, the different barriers that patients face, patients with and without insurance, and transitioning insurance, and some of the big holes in our system. I was wondering also just one clarifying question is, how has your perspective on all this changed? Before you had this, before you knew you had the heart condition, what was your impression of the healthcare system and your experience with insurance, and how has it changed over the course of this experience for you?
Well, when I was younger, as a self-employed musician, I always had to buy my own insurance, but for many years, and I mean, I'm 20, 25 years, it was $80 a month or something, and the deductible wasn't too bad. And it wasn't a thing I thought about. I just had no problems with it. Sometime, I can't name the year, but the premium started going up. And by then I was a little older, and I started shopping it around and going, hey, wait, there aren't any better options. What is going on? And of course, fast forward to today, when it's almost cost prohibitive for many self-employed people.
Thank you again, Steve. There's one story in the chat box that I want to read out, but I'll read the questions too, but we'll save the question part of that for the panel discussion, but just to give everyone a little preview of this story in the chat box. So Caridad Harmon says, I have insurance and was recently billed over $7,000 for an out-of-network emergency room physician at an in-network hospital. Thankfully, I was aided by